hair everywhere. Hello! First one. Hey! First video. So today I'm going to be going over some bits and pieces, just basically why I'm starting this page or blog and everything else that goes with it, how it all links together. So this is it. This is Quest for Pain Relief. Okay, so I'll start right from the beginning, introduce myself. I'm Jess, I'm 29 years of age. I live by the seaside with my partner and my 2 cats, and I work full time. Whilst doing this sort of on the side, because I myself am on a quest for pain relief. What happened back in 2018, I had to have spinal surgery. It was a sort of regular routine microdiscectomy where I had a bulge in my L5-S1 disc, which is right down the bottom of your back. It was one of those things, it was general wear and tear. I had quite a physical job, which led sort of over time to the disc in between my spinal vertebrae sort of prolapsing, bulging and sort of leaking out a bit. So basically they go in and they shave the disc. I had the bulge quite a while and I was working on it, doing sort of stretches to try, because sometimes the bulge will go back in. I started to display sort of the effects of cauda equina. If you haven't heard of cauda equina before, it's just where the nerve that's being pressed on by your bulge starts affecting your bladder and possibly your bowels as well. I was really lucky. I think because I was so, and this is one piece of advice I would give anyone, because I was so open, honest and graphic with my doctor, he was able to go, I know what that is, we need to go. And I was sort of rushed in a couple of days later to surgery. Basically I went in, and I'll be honest with you guys as well as the doctor. I went in and said, when I go for a wee, it's starting and stopping. That was it. I was really lucky. I didn't think much of it, but I thought I'll tell him, because he's told me I've got to look for any bladder or bowel stuff. I said, yeah, it's really weird, it's sort of stopping and starting. And he was like, yeah, we need to get you in. I think with a small amount of people, if you ignore it, if it goes on too long, the effects can be much worse, and they can be lasting as well. I think worst case scenario, you can end up sort of being incontinent. Hence why I was so on it with the doctor, and I said, you know, everything that was happening. So post-surgery, the surgery, as far as we knew, was a success. They'd shaved the bulge. I had to lay flat for 2 weeks on my back, on my front, or I could stand. I just couldn't sit. They don't want you sort of bending to sit down. So that's what I did. They said if I could lay on my front as much as possible, so that's what I did. It was a bit difficult because I'd had my appendix out a couple of weeks earlier. That's a whole different story. I had my spinal surgery. Everything seemed like it was fine. I didn't have any pain just after the surgery, which was bliss. After having a couple of years of, you know, ongoing sort of dull ache, started to get a bit of a niggle, and then from then to now it's just sort of it's deteriorated. Went for an MRI scan end of last year, and the bulge is back. I have got another disc bulge in the same place, which isn't ideal. It now means that the surgery that I had, although it went correctly, it's now classed as failed spinal surgery syndrome, or FSSS. That's where I'm sort of left. I have this disc bulge that's come back. and it affects my lower back and it affects my left hip as well. Sometimes my hip's worse than my back. It's strange, but it's just one of those things. It's a pain. It's a pain. I'm currently on the waiting list for spinal injections. They're sort of like epidural or steroid injections. I know a lot of people have had these. I've had some really mixed reviews when looking online. I know you shouldn't research these things online. Horror stories. Guys, if you've had it, if you're waiting for it, if you know anything about it, please comment, because this is something that I'm sort of looking into, and again, all I've heard is horror stories, and so I'm getting quite nervous about it. I don't know when that's going to happen though. Obviously with lockdown and everything, it's postponed everything, so I think I could be looking at approximately maybe up to a year before any of that happens. So hence why I've started this page. I am on this sort of quest for pain relief. In the meantime, while I'm on all these waiting lists for different injection, but I've also on, you know, waiting to see, you know, pain clinic and things like this, just for general help. It's frustrating. I know that there are people far worse off than me, but living with 24/7 pain, it can get tiring, it can get exhausting. So I am willing to do anything I can to alleviate that. I think I got to the point a couple of months ago where I hit a wall, and it was just so sore, so painful. The only way I could explain it, and it sounds really strange, but it's like you've got sort of like a metal pole or something passing through you. It limits your movement and it hurts when you move, and it's, as I say, it's strange. It's different for everyone. I've got to the point where I'll try anything, and if any of it works, I'll let you know. So I'm going to be doing reviews on products that I've tried. There are some things that I've tried that are really good, and some things which I would like to try and prevent other people from wasting pennies on. I am on a budget, so the things that I tend to try are things that you can either make at home, things that you can purchase off Amazon. Yes, all good. This page will link to the Facebook, which will link to the blog as well. I do have a couple of little articles that have gone up. There's one about dealing with pain during lockdown. That's got different bits and pieces on it as well that I've used, so they're really helpful. I don't want this video to go on for too long, so yeah, I mean, that's pretty much everything. Spinal surgery, didn't go to plan, in a lot of pain, want to help other people whilst helping myself. That's it. That's all this is. I just want it to be a really nice sharing platform of, you know, advice. Sharing's caring. Good. Talking of sharing, be sure to like and comment down below. Subscribe if you'd like to. Ring the little bell. All that stuff that you hear on every single YouTube video that you watch. But also I'm on Facebook, link down below. If there's anyone out there that you know that may, you know, benefit from watching these kind of videos, hit me up. Let's start our quest for pain relief. We can do it. We can do it. We'll find some really cool stuff that we can do that will make things better. Okay. Bye guys.